You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, natural hormone therapy. Is it safe? Is it effective? With us, we have Dr. Liebowitz. You've been doing hormone therapy with women for how many years now?
About 10 years.
Okay, good. Well, I've had you on the show. I think I've had you on the show even 8 years ago, 9 years ago. What's new? I mean, are you better at treating patients now with hormone therapy? And we should mention combination of nutrition and exercise and those kind of stress reduction and sleep, getting enough sleep. But what do you know now that you didn't know then?
Well, one of the things that there's a study that we've been following in Europe. There's actually 2 studies in Europe that have shed some new light on hormone balancing. One is in Finland and one is in France. And what they've done is they've taken women right at the time of menopause. They didn't have any gap, and they put them right on their hormones. So they never went into menopause per se. They didn't have all the symptoms. And these women they've been following for now about 7 years, and so far they have no increased incidence of breast cancer in both of these studies. So one of the things that we're learning is that, gee, maybe it's not we're using bioidentical estrogens now. They're derived from wild yams. They're not the old hormones that came from horses. So there seems to be a big difference between these hormones that are chemically identical to our own natural hormones. And the other thing is we're putting them back in the body in the same rhythm that the body had before the woman went into menopause. And one of the big controversies was from the National Women's Health Association study, the Women's Health Initiative study, and that showed that there seemed to be an increased incidence of breast cancer from these hormones. But one of the big problems was that there was an arm of that study where the women were only on estrogen because they had hysterectomy, so they didn't need to take any of the progesterone. And actually those women only on estrogen did not have an increased incidence of breast cancer. So like, where is the controversy there? Where is the breast cancer link?
So you think it's
estrogen?
safe, but what about the argument that it's not natural? That you know, messing around with hormones, because one hormone affects the other. I've heard you say it yourself. Mm-hmm. So I mean, how are you able to mimic normal physiology, and aren't your hormones, maybe they're supposed to drop as you get older?
That's true.
So
and we're also supposed to get old and decrepit and die. So the whole philosophy of putting the hormones back is to try to keep the body functioning like a younger body as long as possible, because Mother Nature built in this mechanism where when women are no longer reproductive, they're no longer needed. So when women hit menopause, their bodies just start to wither away, and everything about a woman evaporates very, very quickly. Women don't want to accept that. Women in our generation, the baby boomers, they don't want to accept that. And we have an option for them. And it's looking, although we don't have all the answers, I can't say we have all the answers to this, but it's looking safer and safer if it's being done correctly.
Well, okay, what about the argument where somebody will say, well, my grandmother lived to be 100 years old. She didn't take any hormones, just, you know, nutrition.
Great genetics. Great genetics. And I don't believe everybody needs to take hormones. And there's a lot of women who go through menopause.
You don't believe everybody needs to take hormones?
I don't think everybody needs to take hormones.
But if you're, but based on what you said earlier in the conversation, if maybe in your 50s or 60s, you're in hormonal decline, right? Replenishing those hormones.
But some women don't go into decline.
Really? Some women don't get lower testosterone levels.
I've talked to women, I've had women in my office who have no hot flashes, no night sweats, they have great libidos, they have great energy.
What about their hormone levels?
Their hormone levels are low, and they still feel fantastic.
Okay.
Everybody's not the same. There's a huge spectrum of normal for women, and you have to respect that. When you treat patients and you treat women or anybody, you have to respect the fact that each individual is not the same as the person who just walked out of the room.
But you've seen stories where you give people testosterone, or you give them estrogen, and they feel better. Their lives change.
Oh, it can be absolutely life-changing. It can absolutely be life-changing, but you really have to go through a very detailed history and talk to a person about their symptoms and how they feel. Because if you go down a list with a woman and you ask her about all the menopausal symptoms, she has none of them, I don't know why to give her hormones. I mean, you could check for other things too. There are metabolic things that'll change. You can look for some of those. But I've seen women who are super healthy, no symptoms, feel great, look great. It's kind of like, why mess with nature? I think there are just some people like that. Everybody is not the same. But most women, I'd say the great majority of women, over 95% of them at least, do much better on hormones.
Now, I know there's no way to prove this, but are you convinced, because you take some hormones, I think you take testosterone, Right. Do you believe you're going to live longer because of it? And there's no way to prove it, but do you think it adds years to your life or adds healthy years to your life?
I think it's a quality of life issue. I don't know if it's necessarily a lengthening of the lifespan issue. We think it might do that, but it's certainly a quality of life issue.
So more energy while
Absolutely.
you're alive.
Living a fuller, richer life in the moment now, because you're on your hormones, you're going to be a much happier person. Whether it's going to extend your life or not, I can't make that claim, but I can certainly say you'll feel better.
I had a hormone doctor tell me one time on my show, she said, my program allows people to do more of what they love to do in life, whether it's skiing, hunting, fishing, whatever, travel, because they have energy.
That's very true.
Now, you told me this. It's hard to believe, by the way. You say you have an 80-year-old or something, a man with an active sex drive, active sex life.
He was married to a 55-year-old woman. And the thing that's interesting, when he was 50, she was 25. And that's not such a big difference.
So he takes hormones?
But now she's 55 and he's 80. That's a huge difference, right? And he takes hormones and she's having a hard time keeping up with him.
Now, aside from plastic surgery, Hollywood, okay, they look younger than the rest of us, right? And you're in the know. I mean, you know who's on. Would you say a lot of Hollywood in their 50s and 60s, they're on hormones?
I would guess that they do a lot. I think they do everything they can. I think they do a lot of
What's your
cosmetic.
opinion? I mean, do you think so?
Hollywood
A lot of them are on
actors in their
hormones?
50s and
I
60s? Yes, I would say so.
Would you say the peak performing individuals in our society right now are usually on hormones?
Well, you talk about professional athletes. I'd say most of them are on hormones.
Yeah.
But they're not on the hormones we're talking about. They're on performance enhancing hormones, which is completely different.
Okay.
We're talking about replacing
and you think they're
natural
safe.
hormones.
Are you one of I'm going to say one of these guys, one of these doctors that believe that life should be like a light bulb where you live this long life and one day you just die?
Yeah, it's called the
Instead of just
linear
kinda-
lifespan, as opposed to going into a decline and becoming old and decrepit, living a long time, but living the last 30 of your life in a wheelchair or something like that.
But you believe that.
I believe that. I believe you can do that.
You're just going to live like energy and feel great.
Yeah.
Is-
I'm going snowboarding with I have two boys, one's 22 and one's 28, and I'm going out snowboarding with them over Christmas. I don't even think twice about it, and I'm 62 years old.
Yeah.
But I can't imagine my father when he was 62 years old doing anything with me at that age.
So when you hear guys and they're, that are just 72, because that's young today, and they go, well, when you're 72, things just stop working. They fall apart.
I think you can maintain a lot of normal function, but it's more than just the hormones. It really comes down to your lifestyle, like you were mentioning too, getting enough rest, sleeping, not being exposed to too many toxins, not too much alcohol, avoiding the sugars, keeping your weight down. Those are very important components also. The hormones are just one piece of the puzzle. It's not like the magic bullet.
You think it's the edge? I mean, it gives you an edge? I mean, it's good for the heart, testosterone?
It's excellent for the heart, and it's excellent for cholesterol. I had a doctor call me the other day because I put a testosterone pellet in this woman, and she went into the doctor, and the doctor did a routine blood checkup on her. She calls me up all nervous. She goes, oh, my patient's testosterone's too high. I'm worried about her cholesterol. She's going to have a heart attack. So I pulled out her chart, and I looked at her cholesterol. I follow my patient's cholesterol. I do this very sophisticated cholesterol monitoring test, and I looked at her cholesterol, and she had been on statins before. And I said, you know something? Her cholesterol is lower now, and she's not on any medications than it was when she was on her statins. And part of it has to do with the way we're balancing our hormones. If it's done carefully, if things are monitored, and if the patients are given a broad spectrum of ways to get healthy, not just give them the hormone and send them out the door, it's a comprehensive
What about
approach
growth
to
hormone?
health.
And we're out of time, but growth hormone.
Well,
Are you a
growth hormone
fan?
is amazing, amazing hormone.
Really, you're a fan?
Yeah, I love growth hormone. It's just so expensive. That's the big drawback to it. But I've seen incredible benefits and results from growth
Well, if
hormone.
it's so good, then why is it so controlled?
I think it's because it gets abused, and it's heavily abused in
So
the
too much is going to
sports
really be
area.
bad.
Yeah. And testosterone's heavily abused also, and testosterone's heavily controlled. There's a lot of concerns about testosterone too. There's all sorts of new laws that are being put into place to control testosterone. Growth hormone is a great hormone. It's an amazing hormone, and if you can afford it, and if it's done also in a monitored fashion where your levels don't get too high, it can be very, very safe.
I heard there's a new package insert on growth hormone that makes it almost impossible for most people to qualify for it. Is that true? You know anything about
well, qualify, you mean?
that? I mean, where you can,
in terms of a dosing? Or
yeah, to even get growth hormone. The doctors are afraid to prescribe it because I think it's like only 2 years old where they made it some test you have to take. I don't know. I could be wrong on this. You have to take a certain test.
I haven't heard about that.
Okay.
Never heard about
So you just so what clinically? I mean, you just have to. So if you're 50, if your growth hormone levels are those of a 30-year-old, I mean, I'm sorry, are those of an 80-year-old?
Well, we have guidelines. We have guidelines, and they're, I would say they're probably more in line with a 40-year-old.
Okay.
or so. But I have patients who will come to me and say, I need growth hormone, and I do blood tests on them. I go, no, you don't. I've seen patients in their 50s who have excellent growth hormone levels. And I've seen patients who I have made healthier through my programs, through my diet, my guidance, through supplements and things like that, getting them to sleep, getting them to rest, detoxifying them, getting them off a lot of toxins. I've seen their growth hormone come up naturally with no other medications. Just naturally their body makes more growth hormone.
Is this the new aging gracefully? Using hormones and supplements?
Well, it's a whole comprehensive approach to health. And it's a way of looking at health. It's not just taking something out of a bottle and expecting that magic potion to change
Traditional
your
medical
life.
doctors will watch this show.
But you need to spend time with your patients.
But my traditional medical doctors will watch this show. And many of them don't believe in this. What do you say to them about
I see
natural
this every
hormones?
day. I see improvements every single day with my patients, and it's incredible. It even surprises me when I can inspire a patient.
Okay, good.
And I talk to my patients like I'm a coach. And I go, you're the ball player. You have to practice. You have to go out and play the game. I can't play the game for you. I'm on the sidelines. I can coach you. I can teach you. I can tell you what to do. But you got to play the game. When I get a patient who plays the game and they really take it on, I'm blown away sometimes by the results.
So
I get.
hormones will not work if you're not going to eat right?
They work,
that
but
correct?
they don't work as well. If you want to really get healthy and you want to really have a vibrant life, you need to do everything. You need to eat right. You
No
need
gluten?
to sleep right. You need to get off of gluten.
No dairy?
No dairy.
No fun?
You should eat paleo.
No gluten, no dairy, no fun.
It's a lot of fun.
Listen, we're out
You
of
know
time.
you can eat paleo and have a lot of fun.
I know. Okay. I want to thank you for coming on the show. Always a pleasure. Always a pleasure. You've been watching the Wellness Hour Live. I'm Randy Alvarez. We'll be right back.